Good afternoon, everyone. Welcome to this webinar on the IMI2 call for proposal on the topic how big data could support better diagnosis and treatment outcomes for prostate cancer. This topic is part of the IMI Big Data for Better Outcomes program. My name is Alessandra Paccamicio. I'm part of the IMI communications team, and here with me is Carlo from the IMI scientific team. The call topic presentation will be given by Paul and Susanna from Bayer and Sanofi. We will then have time for questions and answers, and a new feature that we'll also try out today is the potential partner speeches that we will explain in a few minutes. So how to use GoToWebinar? You have been able to opt it for a computer audio system or a phone call system. If you use the computer audio, that means using a computer's microphone and speakers. If you do so, please check that the speakers are switched on and not muted, and test your sound if you have a minute to make sure that GoToWebinar is picking up the right speakers. At any time throughout the webinar, you can also switch on to the phone call system in case your audio in the computer fails. The minimized version of the panel may appear on the top right of your screen with just 4 icons. You can expand the menu by using the red and white arrow button. Just below that, there's a gray button with a microphone icon on it. It's gray at the moment because you're on listen-only mode, but if we unmute you, that button will turn green, so that indicates the status of your microphone. There's a full screen button just underneath, and on the very bottom, a blue and yellow hand button. You can use that to attract our attention, or if you would like to speak or ask a question. Asking questions in GoToWebinar is very easy. You can do so in writing by tapping your text and clicking send in the panel, or also using the hand button to attract our attention and ask your question in person. So today's new feature is the potential partner speeches. We've thought about this in order to allow potential partners to be able to network and get to know one another. The idea is to have a 30-second time slot for each person that would like to give a pitch. The person should state their name, organization, how they can be reached or contacted, and what is their idea for an application or what contribution they can bring to an applicant consortium. We will strictly time the statement, so please stick to the 30-second allowance that you have. I already have a list of people that expressed their willingness to give a small pitch today. In case there is anyone else that has not sent me back an email but would still like to give a short presentation of themselves, no problem. You can either use the hand button or send me a chat message. But please remember only your name, organization, how you can be contacted, and your idea for an application or what contribution you can bring to an applicant consortium, all of this in 30 seconds to be fair to all. Before we start, please note that the webinar may be recorded and published on the IMI website and YouTube channel. The presentation slides will be published on the webinar webpage, and the participant list will be also circulated among the participants of the webinar. And I will leave the floor to my colleague Carlo that will explain how the call work for the IMI system.
Thank you, Alessandra. So, as Alessandra said, my name is Carlo. I'm a scientific project manager at IMI, and I have a brief presentation before we discuss the main topic, and this is to let you know how our calls operate and what the IMI is. So today's webinar is mostly going to focus on the topic itself, and that's mostly the reason you're all here. This, as Alessandra said, this will be presented by the industry topic writers, and it will cover the various aspects you can see there. One thing we are not going to cover today is the actual rules and procedures regarding submission of proposal, how they're evaluated, and so on. I will give you a brief guide now, but we'll have a dedicated webinar for this in the new year on the 9th of January at 2 p.m. So you can register for this at the link there. It's the same registration page that you registered for this particular webinar, and I would encourage you to attend that webinar as well if you're interested in applying. So first of all, who is the IMI? Who are we? Why were we set up? And what are our objectives? Well, IMI is a public-private partnership between the European Commission on one side and industry, the pharmaceutical industry on the other, although we do also now under IMI2, under Horizon 2020, we also encourage other industries to take part in the partnership as well. Our mission is to facilitate open collaboration between all these partners to advance the development of and accelerate access to personalized medicines with a very much on improving the health of patients and in unmet medical need. So those of you who are familiar with IMI will know that when we were first founded, our focus was very much on the earlier stages of drug discovery. But as we've evolved, the focus is now shifting much more towards having an impact on the daily lives of patients. And it's in that context that this particular topic should be viewed. So in more detail, we see ourselves as a platform where a multidisciplinary consortia can operate and can have conversations and do research, which is not really feasible outside of such collaborative projects. We have the necessary scale in terms of resources and in terms of expertise to really take a step forward in particular disease areas. Our projects themselves, once they're up and running, they're built on trust, and this is actually true of all the projects. Both from the industry and the publicly funded side, the collaborations are based on mutual trust, sharing of data, sharing of results, and really all focused on the end objective of the topic, which, as I mentioned, should be focused on delivering for the patients. So overall, we see ourselves as a neutral platform where multi-stakeholders, and I'm talking about not just the industry and say academics, but also SMEs, regulators, health technology assessment organizations, payers, and so on, where everybody can get involved to really make a big step forward in terms of the topic area. So I have a number of slides here now to explain how our topics are formed and how the evaluation of our proposals works. And the reason I'm doing this is because we, although we're under the Horizon 2020 umbrella from the European Commission, we do have some specificities which is very important for you as applicants to understand because they are crucial to be putting forward a viable proposal. So the first thing I'll focus on is the topic definition. Where do the ideas for our topics come from? And the way this works is that we have groups of FPA companies, so pharmaceutical companies, who meet regularly in different thematic areas. And the idea of these meetings is to discuss topics of common interest where the industry themselves thinks that individually they perhaps cannot tackle the issue, or even as an industry alone they cannot tackle the issue, but they really need a greater partnership to make that big step, that big piece of progress that we want. And as a result of these discussions, we get a draft topic text. We get which represents what the industry thinks they should do, and also contains the resources and the resources that the industry are willing to put forward to a topic. This text is then consulted with all the member states to ensure that that public need is also included as well. And the industry resources are matched by European Commission funding, and this is then launched as a call for proposals. So the important thing to note here is that the topics are focused on industry need, but they also include that important public need to ensure that we do have the impact on the patients. And this is the stage we're at now. We're at call launch, and at this stage, the industry take a little bit of a back seat, and it's up to the publicly funded applicants to put forward their proposal to address the topic text. So this is the stage we're at now, where you as applicants should form a consortium to address the public activities. So half the topic will be industry activities and half the topic will be publicly funded activities. You should make sure you address the activities which are aimed at you as an applicant consortium. And it's up to you to put together a consortium to meet those needs as described in the topic text. And our consortia typically consist of academics, hospitals, SMEs, mid-sized companies, and so on. There is a section in the topic text detailing applicant consortium, and you should read that carefully. So once you put your consortium together and written your proposal, you will submit that to us, and then it will undergo an evaluation. This evaluation is where we select the proposal which will go forward to stage 2 of this two-stage process. And one difference here between us and Horizon 2020 is under IMI, we only ever select the best consortium to go through to the next stage. Okay, so only one proposal will be successful. And therefore, stage 1 is our main competitive stage, and it's crucially important that you put forward extremely feasible proposal. Under Horizon 2020, maybe it's good enough to be on a very good proposal. Under IMI, you really have to be on the very best proposal. So my advice here is to put a lot of effort into finding your partners and spend a lot of time thinking about your proposal itself and what you're going to put in that. So following the evaluation, the first ranked consortium from stage 1 then merges with the existing industry consortium. And together, these two consortia then write a full proposal, which is a much larger document, much more detailed in terms of the work plan, what the tasks are going to be, what the deliverables are going to be, and so on. However, on this slide, I've put the diagram here to show you that it's the two consortia are merging. But at this stage, we like to think of you as a single full proposal consortium. And this is the key to IMI. So in IMI, we're not just two separate organization types working together on a common project. Everyone works together, totally integrated in a single consortium. So this is a key thing, and I think for a successful project, it's where everyone knows what they're doing and everyone works together well to meet the common objective. So at stage 2, you submit a full proposal, and this is again evaluated by independent experts. And if that is successfully evaluated, then we've got a little bit of administrative details to sort out for the grant preparation stage. Very importantly, there's a consortium agreement, which is a legal agreement between all the participants in the consortium in terms of governance, intellectual property rights, and so on. And if this goes well, then the project gets launched and the work can begin. So how to submit a proposal? Those of you who are familiar with IMI will know that up to date we've been using our own proposal submission tool called Sophia. From Call 10 onwards, we are now moving to the European Commission Horizon 2020 proposal submission tool called SEP. The link is there. This should greatly simplify the submission, as a lot of the tasks are now automated. But I still recommend that when the call is launched, you go to this tool as early as possible so you can see what sort of information you are requested to have in this tool. And also within the tool, you can download the proposal template, which is what you need to fill in with your actual proposal itself. The submission is made up of two parts. Part A is administrative detail on the organizations that will be in your proposal, and Part B is the actual proposal itself. So another slight difference between IMI and Horizon 2020 is that our proposal template is slightly bigger, and this is to reflect the fact that our main competitive stage is stage 1. This template, as I said, it will be available on our website and also within the submission tool itself. Our page limit is 30 pages, so it's bigger than before. And we also request a little bit of an extended proposal size. So we ask for people to address excellence, impact, implementation, and a brief description of the participants in your consortium. So once your proposal is submitted, we will go through an evaluation. It's very important that you recognize what the criteria are of this evaluation so that you can tailor your proposal to them. So for your information, the evaluators are given 3 pieces of information. They're given your proposal, they have the call text, and they have the evaluation criteria. And they are instructed to use just these 3 pieces of information when they're doing their evaluation. So I've got the evaluation criteria on the screen here now. I'm not going to go through them individually, but just that you should be aware that this is what they will use during the evaluation. So make sure that when you're putting your proposal together, you do make sure you've addressed all these issues. So they fall under excellence, impact, and implementation, which fits with the proposal template itself. Okay, I have a few slides based on our experience of how to put together a viable proposal. So this is call 10 of IMI2. We had 11 calls in IMI1. So this is based on our quite an in-depth experience of what sort of proposals score highly and what sort of proposals don't. So our first piece of advice is to make sure you do read all the call relevant material. So I'm sure you'll read the topic text several times, as you should. At the bottom of the topic text, the actual published version, which will be on our website when the call is launched, there's a section called Call Conditions. And these are basically the rules that you need to follow. So I'd recommend reading those as well and make sure you understand them. If there's some question you have on those, feel free to contact us in the office for clarification. A key piece of advice is to begin forming your consortium early. As I said, our competitive stage is stage 1. We only put one proposal through stage 1, and therefore you have to be on that one proposal. And the earlier you start getting yourself on that one proposal, the better. So there are various partner search tools, networking events, and our new pilot of the 30-second pitch, which hopefully will help you find good partners for your consortium. I've already mentioned how important it is to make sure you provide the reviewers with information to give you a good evaluation. The reviewers are instructed to only use those 3 bits of information I've already mentioned and not to look outside those. So don't assume that they have a great knowledge of your organization. Make sure you put it in the proposal itself if there's some particular expertise you have which you want to flag up. And also very importantly, and this is based on a lot of experience, make sure you submit your proposal early. We still get calls from people who've missed the deadline and ask us, can I still submit? And unfortunately the answer is no, there's no opportunity to submit if you've missed the deadline. So my recommendation is to submit at least 24 hours in advance. And therefore that if there's some piece of information which you suddenly find you need to submit and you don't have it, it gives you a bit of a buffer time to find that. And as I said, if you need any further help or assistance, please do contact us at infodesk@imi.europa.eu. So some common mistakes we experience are before your proposal goes for evaluation, it has to pass some very basic admissibility and eligibility criteria. So the first one is the submission deadline, which I already mentioned. The second one is for a proposal to be eligible to be evaluated, it has to contain at least 3 legal entities, separate legal entities from at least 3 separate member states or Horizon 2020 associated countries. So please make sure you do have this. If you don't, the tool will give you a warning, but it will still allow you to submit. So make sure you do get at least 3 organizations from at least 3 member states. At the evaluation itself, the reason some proposals don't score so highly are perhaps they do not address all the objectives of the topic. So under IMI, it's very important that every objective targeted at the public consortium is addressed by you. You cannot just pick a part of the topic that you like. You must address everything. And when you're doing that, bear in mind that we do receive a lot of scientifically excellent proposals, but excellence is only one of the evaluation criteria. They're all equally weighted, so you must also focus on impact and implementation as well. Impact is becoming extremely important, so make sure that you do have that scientific excellence, but also demonstrate how that scientific excellence will feed through to have an impact on the patients. And of course, this being a public-private partnership, it's very important that you explain how you're going to integrate with the industry consortium at stage 2 and consider what the expertise they are bringing. So finding project partners is obviously crucially important. So our advice is to, first of all, network with your own contacts. This is probably your primary way of finding partners. Now, we acknowledge that IMI topics are complex and using your own existing contacts may not be sufficient, but you really need to actively pursue different expertises to ensure that you do meet the broad requirements of the topic. So networking with your fellow webinar participants is also useful. These are people who are obviously interested in the topic. As Alessandra said, we will distribute the contact list of those who have allowed us to share their information, and we do have this opportunity for you to give us a brief pitch of your expertise. There are various partner search tools. I would register on all of them. We have, at IMI, we have a group called our States Representative Group. These are people in each member state. They are very, very familiar with IMI. They receive a lot of information. They have a lot of experience. I would definitely get in touch with your local SRG member. If you click on that link, it will bring you to the page on our website where their details are. The European Commission has health national contact points, which have a similar role, and maybe you get in touch with them as well. And then use any other networking techniques that you can think of. For example, you can maybe put a post on our LinkedIn group under the relevant topic. So I've got 2 slides to finish off on participation of SMEs and of patients. Both of these stakeholder groups are extremely important to IMI. SMEs, we see them as a mechanism to really drive the results of a project all the way through, and once the project finished, to make sure those results are sustained and do have that impact, which is very important. In this particular topic, there are obviously a lot of opportunities for SMEs to get involved, and we would encourage anyone who's putting a topic together to reach out to SMEs so that they can address some of these areas. And a second very important stakeholder group is the patients. Obviously, we want all our projects to have an impact on patients, and having patients as part of your consortium is a way of ensuring that will happen. So I've listed a few areas there where patients can contribute, but I think the second last point there, the nota bene, the consortium will also include caregiver and patient advocacy organizations. This is a direct quote from the topic text, so therefore there is an expectation that your consortium will have those groups, so please make sure you do. And I think the way to consider patients to make sure that they're integrated throughout your consortium is to review the patients as another form of expertise. You will obviously include academics, you may have SMEs and so on. If you view the patient as an expertise in their disease as well, and at that level, that will ensure that you do really maximize their contribution and ensure you will have that impact. So that said, if you do have any questions on anything I've said there, you can ask them at the end of the webinar, or you can send an email to infodesk@imi.europa.eu, or of course there's the webinar on rules on the 7th of January. But now I'll hand over to Paul, who is going to give the main presentation on the topic itself.
Thanks, Coleman, Alessandra. My name is Paul Petraro. I'm a senior epidemiologist at Bayer. I'll be talking about the topic. And I also have on the line Susanna. Her last name I'm not going to try and pronounce. I'm bad at pronouncing last names. She is the co-lead on the development of this text. And I just wanted to point out that the development of this text was a collaboration of a number of collaborators from different pharmaceutical companies, as well as we had sort of analytics and tech folks in terms of platform and that aspect of this project. So we had expertise on a number of different areas. So I just wanted to start with the title, and I'm going to read, I assume everyone has read the topic text that was published on the website, but I'm going to read off the topic text a couple of things that I think are extremely important. And our title is How Big Data Could Support Better Diagnosis and Treatment Outcomes for Prostate Cancer. And I just wanted to give sort of, this is under the IMI2 Big Data for Better Outcomes program. And as the text says, the IMI2 Big Data for Better Outcomes program aims to catalyze and support the evolution towards value-based and more outcomes-focused, sustainable, and therefore better quality healthcare systems in Europe, exploiting the opportunities offered by the wealth of emerging data from many evolving data sources by generating methodologies and data that will inform policy debates. And I think that's key to what we're trying to do here. So now the need for public-private collaboration. I think some of this Colm already talked about allowing expertise and bringing together a number of collaborators that wouldn't necessarily be able to collaborate in their standard environments. In terms of prostate cancer itself, the majority of research has been focused on clinical trials, tools, and operational efficiencies. And early on, when we were talking about developing this project and this text, one of the comments made actually by my co-lead was, and I think this really hits the nail on the head, is that more or less prostate cancer, we can say, is about 10 years behind breast cancer in terms of the development of these types of initiatives. So we wanted to bring together some sort of collaboration that would allow this. And we really want to make sure we get everybody into this sort of collaboration: patients, caregivers, advocacy organizations. We want to rely on academic groups, SMEs, IT support, and so on. Next slide. So the objectives of the full project. Again, here I'm actually going to go back and read something directly off the topic text, because I think when we start out in the topic text, we describe the scope of the project and the primary objectives, and I think this summary really hits the nail on the head again and really gives us a good overview of what we're trying to do here. So the scope is to address the scarcity of epidemiologic, clinical, genomic, biomarker, economic, patient-reported outcome, and humanistic data on the treatment path of prostate cancer, including all stages of disease. We want to leverage real-life data on patients from different European companies using existing registries, trial data, and data from prostate cancer specialized centers, as well as data from patient groups. The primary objective is to increase the body of evidence to improve prostate cancer outcomes by identifying and broadening the relevant outcome measures. This includes screening, diagnosis, and predictive factors that may have an impact on these measures across all stages of disease through collection and analysis of available data. And as you can see here, the objectives of the full project, if we sort of look at the top half of this, that's sort of the foundation. We want to identify data sources and strategy for EU-wide data sharing. We want to enable a sustainable data platform and access. We want to generate and share results of data access for better outcomes. So this is the foundation here, where we're thinking about a platform where we can bring together lots of resources from sort of your real-life data aspect and utilize them to develop a center of excellence network across the EU to share best practices, to develop guidance on treatment pathway and access. And when we think about these three, we're thinking about how to leverage the information, the data we're gathering to use to develop these practices and so on. Next slide, please. The pre-competitive nature. I think Colm sort of talked about this already. So this is a neutral platform allows pharma companies to collaborate with all of the above: academia, payers, regulators, and other important stakeholders to facilitate these discussions and recommendations and come to some way of how we can utilize all of this information. We want value-based healthcare with increased health outcome focus to allow us better use of these scarce resources. Next slide. The expected impact of this project. So what do we hope to achieve here? So we want to optimize diagnosis and treatment of prostate cancer. We want to have a clear understanding of relevant clinical, economic PROs. We want to understand the pathway and the natural history. We want to enable the data collection to broaden for new generation for diagnostic and treatment pathways. We want to work with payers to broaden acceptance of data, value, and outcomes. We want to investigate innovative diagnosis and treatment interventions. We want to promote efficiency of healthcare with the right treatment for individual patients at the right time. And here is where we think about this concept of bringing together large amounts of big data, real life data, to sort of develop analytics and tools and ways of sort of understanding the data and translating it into practice. Next slide. So I'm just going to go through this briefly. When we thought about it, we developed 8 work packages on how we would sort of achieve our goals for this project. And if we look at the first 2, your usual project management, administration, bringing everybody together, that takes a lot of effort to sort of bring lots of academics, industry, and so on to the same room to get everybody on the same page, to initiate discussions, to coordinate activities. That's where we come from on work package 1. Work package 2 is where we're getting our experts together to sort of come up with what are our definitions, how do we understand the disease, how are we going to translate that into the information we're gathering, what terms are we going to use to define various aspects. The next 3 work packages, 3, 4, and 5, is really that sort of foundation of our big data environment. So how do we get data access and data sources? How do we bring those together? How do we develop a platform? How do we do our data analytics? How do we set up the infrastructure to work through all of this so that we can build on the next 2 work packages where we start talking about HTA and EMA payer integration, dissemination and communication, the bulk of what we're going to do with this information. And then work package 8, legal ethics and governance. Here, this is a pretty standard work package. Lots of the other IMI initiatives have this and are developing this. This is when we start thinking about sort of patient information, access, security, and so on. What's legal in certain countries that's not legal in other countries? How do we go about this when we're thinking about data sources from various countries, various entities, and so on? And in the topic text, there's a lot more detail on what we think some of the key aspects are for each of these work packages. Next slide. So expected contributions of the applicants. So here, let me apologize too. When we're talking about this text, it was really difficult to visualize things, and in PowerPoint, it's not so nice to have lots of text, but this was the only way we could sort of get the information out there and at least initiate some discussion so that we can answer questions and so on. So the expected contributions of the applicants, it's the ability to engage with and manage multiple disciplines to deliver on the stated objectives of the proposal. And as I'm already only 5 or 6 slides in, and this is sort of a repetitive topic, and this is a key to what we would like to do. We want to access to real-world data sets that have not yet been used in this context. And what we mean here is we want data custodians who can and will offer up their data to the platform. So without any data, we don't have sort of the next step to the project. So we need to sort of figure out ways to leverage this different sources of information. The ability to engage partners across multiple geographies is also expected. So we hope that this collaboration will not be sort of one region or one country or one academic center. We hope to have a very robust partnership with lots of different entities. On our side that developed this topic text, we have a number of different partners that have played a role in developing this text. And then we want to encompass all key dimensions and include the insight of the relevant stakeholders. So we would like to involve as many as possible, the more the merrier. HTA payers, academic networks, cancer registries and information systems, patient associations. Several organizations would allow for a nice, well-rounded, independent group, allowing for robust input. Cancer reference centers, genomic sequencing groups, medical societies, big data companies, and the like. So that list may not be exhaustive, but just to give you an idea of what we're envisioning. Next slide, please. So what is sort of our contribution, this industry side? So we facilitate collaborations and partnerships. That's sort of when we were thinking about that work package one, we're going to help to bring everybody together to sort of get the ball rolling, so to speak. We provide relevant data sets, existing and future, on treatments and outcomes in prostate cancer. We have expertise in the performance of clinical trials in prostate cancer, with and without the involvement of advanced therapies, the capture and analysis of outcomes research, including real-world data, biomolecular samples, etc. Statistics and data mining, emerge in large data sets from various data sources, project and results communication, and legal and regulatory requirements relevant to the project. So really, when we think about this, we hope both sides of this collaboration will mesh together well, because each side will have similar expertise in numerous members of the collaboration that we can sort of bring together to work on this project. And we also sort of weigh on the IMI2 initiatives, the Big Data for Better Outcomes. There's a number of projects. There's specific ones in other therapeutic areas. There's a broader one that sort of oversees some of the key elements when we think about legal and ethical and those aspects, project management, the platform itself. Those can be used across various topics. So we want to leverage that as well to some extent, that we don't have to reinvent the wheel and reproduce things that have already been done in earlier projects. Sorry, I was going to that next slide. So what's in it? What's in it for you? So we think about this, and I hope this relates to everyone across the board. So influence, there's the opportunity to drive and shape the agenda. We will all sit together to develop a proposal and a strategy that meets everyone's needs. Network, this gives us the opportunity to facilitate access to decision makers and subject area experts, methods, and prostate cancer specific. We hope to get everyone involved, HTA, regulators, academics, the capabilities to develop in-house capabilities as part of the broader consortium. Again, we're talking about methods expertise, prostate cancer expertise. And then I think this is the key here, is data access, or maybe we could say there, not necessarily data access, data availability through the project, through building trusting relationships. And I think in the topic text, we talk a lot about this when we're talking about work packages 3, 4, and 5, about the platform and the data sources, that how do we develop this platform when there's huge amounts of data that don't necessarily or aren't necessarily allowed to be sort of removed from sites, but how can we leverage that together? And we could talk about that more in the Q&A. And then maybe some key, from patient organizations' perspective, it's a definition of a minimum set of measurable patient-relevant real-world outcomes in digital patient engagement solutions. Researchers and SMEs to develop recommendations on appropriate metrics and data categories from real-world evidence in prostate cancer. We have data strategies to collect and characterize these outcomes, and then to bring together, again, as we said, regulatory, HTA, payers, and policymakers. Next slide, please. So before we get into the deliverables of the project, here we try to sort of outline what we see overall from this project, which to confirm clinical and patient relevant outcomes. So we want to collect, share, and harmonize big data. So our first step is to assess and integrate large amounts of data. So how do we do this? How do we get all of this information? And then what are we going to do with it? How do we want to use this? We want to identify novel surrogates to inform treatment decisions. We want to improve collaboration between diagnostic test developers. We want to facilitate development pipelines and accelerate bench-to-bedside process. We want to identify target cohorts and disease subgroups. So sort of that's the next level, the next step in the process. Then we're going to unmet needs addressed in diagnosis, therapy, patient management. And what does this all mean to us? So we want to harmonize innovative practice. We want to facilitate reimbursement decisions, speed up access, and so on. Next slide. So here I'm going to pause for a second. Here we're going to go through the remainder of the slides of the key deliverables of the project. And I don't want to read out every key deliverable word for word, so I'll hesitate on each slide to give you the opportunity to go through the slides a bit as we reach each slide to read through them. These are basically came directly from the topic text, and when working on the presentation, thinking about how do we describe the deliverables of the project without missing any key points and get that into a presentation format, it was really difficult to sort of limit text. So these are very text-heavy slides and a lot of information, but we thought they were very important to describe what we see as the key to this project, what we hope to deliver at the end of the project. And it goes back to some of the things I was talking about in the earlier slides, but sometimes repetition can be a good thing. So first thing is the mapping of available data sources and key clinical, economic, and quality of life patient reported outcomes measures. And two, to develop a data integration strategy. And here the first one I think is key, is we want to be able, we don't want to start over. We want to leverage expertise from previous IMI projects. There's EMIF, there's EHR for CR, there's a number of current big data for better outcomes projects, including the CSA. And here I think when we think about this, there are initiatives out there that are trying to bring together large amounts of data and big data sources, and they have expertise and they've been working on these projects, and we don't want to sort of come up with a separate strategy, a separate way of doing things. We want to be able to utilize what's been done already and build upon that when we think specifically about prostate cancer. We want evaluation of suitability for combining different data sources, assessment of benefits of combining data sources. So here again, we're going to have to do lots of sort of legwork where we think about, well, we talked about lots of different data sources. We were specifically very broad on talking about data sources and didn't focus in on one type of data source because we thought we want to gather as much information as possible for this project, and we want to do it systematically. So we want to think about each data source that may be potentially viable and whether it's feasible or not. So I think this would come out as part of one of our deliverables in the project. And then evaluation of the technical and legal feasibility of combining data sources. Next slide. Okay, so here, again, these first few objectives are really all about bringing together the information. those work packages right in the middle, 3, 4, and 5, about data sources, a platform, analytics. So now we're talking about, in our third deliverable, integration of multiple data sources into a multi-country data sharing platform and new electronic endpoint proposal. Mapping of digital solutions, options across outcomes, clinical and pharmacoeconomic, potentially including maybe a demonstration project based on results from evaluation of suitability, peer-reviewed publications of validated endpoints, portable data capture protocols, and modules for implementation in healthcare system electronic medical record, data governance, a definition of data integration model to be potentially implemented in phase 2 of the project. Next slide. So I'll start talking, and if you have a chance to read through it. So there we're really talking about the steps and the deliverables that would come about from developing a strategy, bringing together data sources, bringing together information, coming up with a platform, and also along with that foundation and that platform itself, what types of things would we disseminate, will we provide to the public, and so on. Now we start talking about, we're thinking about, I think, back to work package 2, where we start talking about definitions, assessment of prostate cancer epidemiology, disease course and progression and burden. So what's out there? What are the relevant endpoints linked to prostate cancer? Going back to the literature, so we're not reinventing anything or coming up with totally different concepts. Aligning everybody on the relevance of the outcomes for different uses. Assessment of the outcomes in the current data sources and expansion for additional data items where currently not available. So then when we think about this, we have a platform, we have all this information, and the next goes into the next one, build on new knowledge developed during the project to guide and propose best practices outcomes. So we've gone through this, we've looked at the existing definitions and information out there. What does this platform and these data sources add? Are there new things we can define or ways of looking at the information? And that's sort of what these deliverables target. Next slide. So deliverable 5, identification of patient pathways and sequences and modalities of treatment used by physicians and associated health outcomes. Let me hesitate for a second so people could read through before I start talking. So here we're starting to get into some of the more nitty-gritty deliverables of what types of recommendations we're going to make, what we want to identify, what represents value for prostate cancer patients. And this is where sort of that collaboration between experts and patients and caregivers and so on is really key, because how we want to be able to look at both sides, how we value the patients as well. Collection of genomic data available in databases to better inform treatment choices and novel predictive and prognostic markers. Here we're starting to talk about specific data sources that we may or may not be able to access, or it may not fit into our network, but what are key components to our project. And economic endpoints, cost, resource utilization, and understand how economic burden of disease increases prostate cancer. Next slide. So the last 2 deliverables, I'll just hesitate for 1 second. I apologize for lots of text-heavy slides. So here we go back to work package 5 on analytics. So now we have all this information. We want to develop methods and tools to describe the natural history and inform epidemiologic and health economic models. So now we have this information. What type of methodologies and tools can we use to sort of parse through this information? And number 12, our final deliverable, to gain advice alignment on all recommendations, frequent engagement and in-person symposium with representatives of HTA and regulator agencies, and payers responsible for making access and reimbursement decisions. So here we're thinking about, we don't want to come up with this huge platform, brilliant, beautiful, bring together all these data sources without having the other key stakeholders and what we would use this data for not being a part of this, so that everyone is on the same page, so to speak, at the end of the day. And next slide, I think that was the main presentation. I think I covered the key points. And as Colm stated earlier, please, if there's any questions or information you want, further clarification, etc., after the call, please contact the IMI program office through this email or their contact information, and not necessarily myself or the other collaborators on the project directly. Susanna, do you have anything to add before we move to the Q&A period? I hope I gave a good overview.
Yeah, thank you, Paul. I think you summarized very well. A couple of things, just as a summary, I want to add. As you mentioned, we thought this is really important and critical for several reasons. One, these patients are diagnosed in many cases too late, and this limit the options in the treatment flow for the patient. The second one, although the prevalence incidence of prostate cancer is almost exactly the same as breast cancer, we all know that the therapeutic success, the awareness, investment in prostate cancer are lagging like 10, 12 years behind breast cancer. So with this project, we want to provide quantitative data and support to accelerate our understanding in prostate cancer, the treatment, the diagnosis, and the treatment of the patient. We would like to provide better outcome to measure and predict the treatment efficacy and the disease progression as well. So we want to summarize during this process and project all the information available and accessible, and derive the appropriate conclusion and guide both the diagnosis, the clinical study designs, development, and also access. And ultimately, we want to save more lives in prostate cancer.
Thanks, Susanna. Just to end, I want to thank everybody. I know there's a number of participants on the call that, besides Susanna, that have been involved in the development of this topic and have worked through the process, that aren't necessarily speaking right now, but played a critical role in this process thus far. And we'll eventually meet at some point down the line, hopefully. Thanks, Colm. Thanks, everyone. I think they're going to open it up for questions now.
Thank you, Paul, and thank you, Susanna. So yes, indeed, we're going to take people's questions at the moment. So while we wait for attendees to get their questions organized, I'm going to read a few ones that we got while you were presenting. The first one was from Imran Omar, who asked if the proposal could be modified after being submitted if still within the deadline. And the answer is yes. If you're still within the deadline, you can modify it once it's been submitted. Hendrik would like to know if the attendance list will be available. Hendrik, yes. Those who have consented to the use of their email address and contact details for circulation will receive a participant list for this webinar. And then Renee has a question for Paul. The question is, how much emphasis will be given on diagnostics of prostate cancer?
Diagnosis of prostate cancer?
Diagnostics of prostate cancer, yeah, that's what the question says.
So there, I think it depends on where the proposals come from and how the projects develop. I think we do think that's an important factor to be considered. So we would like that included. How much weight is put on it is up to the applicant. Susanna, are you still on the line? Would you like to add anything?
Yes, I think if we would like to cover the whole patient journey, I think that we should start with the diagnostics. And especially there are lots of questions around how the patient should be diagnosed, about the PSA screening, when it should be done, whether it's cost effective or not. I think that's going to be a key part of the project, and when we define the clear measurements and this is how we start to describe the patient journey.
Great. Alessandra, are you still there?
Oh, sorry, excuse me. Yes, I was speaking, but I was actually muted. Thank you, Paul. So we see no other questions for the moment. I would say if anyone has questions for Paul or Susanna, please let us know as soon as possible, because otherwise we'll move on to the pitch session. Perhaps we can just wait a couple of seconds.
And Alessandra, I assume that if anyone has any questions after the webinar is over, they can reach out to this email on the info desk and we can address them as they come in. Is that correct?
Yes, that's correct, Paul, absolutely. Anyone can send an email to info@imi.europa.eu, or if necessary, also call our office here in Brussels. My colleague Colin will take care of answering any questions, and then we will redirect any specific detailed question to our colleagues, for example, in the legal department, or we will get all the information that people need to get. But it's very important to direct all the questions to the IMI program office and not to get in touch with the FPA group, with the topic writers. That's a very good point to highlight. I get a question, Paul, from Henkian, asking, can you be specific about the type of data to be collected? There is a range of data and we need to select.
So I don't know if Tom Abbott is on the line. We worked on this together, or someone from Eric or Andras that can assist with answering this. But the idea was to leave it very broad, because we hope to bring together a number of different data sources, but we also wanted to leave it more in the applicant's hands to think about where their stronghold is. If the proposals are coming from genomics sort of academics and so on, that may have a higher focus than other data sources. And we thought there are so many data sources out there, different types of data, that we didn't want to target it too much. I don't know, I may have answered a question very vaguely. Susanna, any thoughts on that?
Yes, so I think that the first and most important thing that we need to be aware what kind of data is available, the quantity and the quality of the data, what we can access. And based on that, we can define where we are going to focus on the project, but also we can define potential data gaps, and we can work on it, how we can fill these gaps as well. But it also, as a point zero, it's very critical to understand what kind of data is available, and as I just mentioned, especially the quality of the data.
Chapter 5.
Thank you, Susanna. Thank you, Paul. So Enkian is adding, prostate MRI is becoming very important in diagnosing and treating prostate cancer. This can take up a whole project. Is it feasible?
So with MRI, I do agree that it's getting very complicated because of the reading. And as in the clinical studies, usually there is a central reading of the MRI data. I think it needs to be discussed how we can fit into this process, but I do agree that it's getting more and more important together with the genomics data. So I believe we cannot exclude at this point, but we need to discuss very carefully how we can summarize the MRI data from different sources.
Thank you, Susanna. And then Jack Shaken is also adding on to the previous question, saying, so only already existing data, not generation of new data?
As I just mentioned, if we would like to do a good job here, it means that we need to identify data gaps as well, because I don't think that we have all the necessary data to answer all the questions right now. And once we identify the current data gaps that need to be filled, I think that could be also a part or a sub-project linked to this one, how we can bridge these gaps to be clear and to provide the best understanding of the disease.
Thank you.
Yeah, exactly.
Go ahead.
Follow up, Dana, is yes, I think that's key. Early on in the sort of when we talk about the project and the different work packages and so on, it's vital to understand the data out there and see where the gaps are, and whether that means a sub-project to collect new information or to write a white paper on it to relay to prostate cancer experts and practitioners that this type of information is vital and we need this information. Those are aspects we definitely would like to answer.
Thank you both. And a similar question came in from Ulrich on existing data versus new data. Please, Ulrich, in case your question has not been answered, let me know and we can unmute you so that you can ask a follow-up question.
While we wait and see if he has any follow-up, if I could add to that, I think when we think about this, the key is with existing data versus new data and so on is everyone, it depends on specific questions. There may be key players or people out there that have specific questions that there is no existing available data, and they may need or want to collect new data. And what this project could obtain is where those gaps are, that maybe someone is planning to do some sort of registry or prospective data collection or trial, and by understanding these gaps, that may be something that could be incorporated into new studies and new data collection that happens while this project is ongoing and evolving.
Thank you, Paul. So we have no new question, and I think that we should move on now to the potential partners' pitches. And before we do that, actually a question just came in from Andreas asking about the validation of findings. Would require analysis of new samples? Is that foreseen?
I don't think this project can do that. I think when I was talking about the quality of the data, we need to clearly define the sources and how the data was collected. But I don't think that under this project we will be able to specifically validate the data what we are collecting. I think it's very critical to use very reliable sources and combine on a methodologically very diligent process. But Paul, correct me if I'm wrong. I'm not. I don't think that the validation of the data will be part of this project.
Yeah, I think that would be out of scope at this point. I think when we think about the analytics side and validation, we may be able to use different methodologies to validate based on what we have available. And if we're unsure about certain measures or something that may require a more precise validation, again, that's something we can address in sort of white papers and during the project, things that we feel are limitations and need further work down the line. Because we have to think about, too, we don't want this to be a one-and-done sort of project. We want this to build this platform and work through this so that it can sort of continue on and be enhanced and improved even after the project is over this initial 5-year period.
Thank you both. So now let's move on to the pitches session. So first one is Ulrich Genig. I apologize in advance in case I get wrong any pronunciation. So Ulrich, I am unmuting you, and if you can hear us well, can you just test the sound, please?
Yes. Can you hear me?
Yes, very well, Ulrich. And you have 30 seconds, please.
Good. So my name is Ulrich Genig. I'm from the ETH in Zurich. I'm representing here the groups of Ernst Hafen and Rudi Ebersold. I can be contacted via email. It's ugenic@ethz.ch. We have two aspects that we can bring to this application. One is that we have expertise in mass spectrometry of prostate cancer samples. Maybe interesting to link that with genomic data. And the other part is that we started a health data cooperative that may provide an interesting mechanism to link patient-contributed data to clinical data.
Thank you, Rick. Slightly over time, but that's okay because you're the very first one. So you were a very good test. Thank you very much. I'm going to mute you now. So the next one came in from Alessandra Micheletti. Unfortunately, she is not well today, and she asked us to read her text for her, and I will try to do that by staying within the 30 seconds myself. So name is Alessandra Micheletti from the University of Milan, the Adams Research Center. A Center for Advanced Applied Mathematical and Statistical Sciences. Their previous experience is integrating the analysis of clinical and metabolomic data to identify variables, relationships of risk factors connected with specific diseases, such as heart attacks, diffusion of influenza, metabolic alterations, and so on. No previous focus on prostate cancer, but they're very happy to collaborate in this field in the future. And the email address is alessandra.micheletti, Micheletti, @unimi, like University of Milan, .it. Okay, next up is Henk-Jan Huisman that, if I'm not mistaken, was asking questions just beforehand. Just one moment, I will have to unmute you. Yes, could you please test the audio?
Okay, this is Henk Huisman.
Yes.
Yeah. Okay, I'm an assistant professor in medical image analysis at the Radboud University Medical Center in the Netherlands. I can bring over 20 years of experience with prostate MRI, quantification, and pattern recognition, and I have a specific interest in prostate and lymph node metastases. I'm currently using deep learning on a dataset of 5,000 prostate MRI to research methods for MRI quantification. I can bring the latest deep learning analytics to help analyze, segment, and quantify big imaging data for data mining. I can bring machine-independent quantification to help merge imaging sets, and I have experience in EU projects, and I look forward to join the proposal.
Thank you very much, Henk, and very well done with the timing. I will mute you now again. Next up is Lydia Makarov. So, Lydia, you are now unmuted. Hi.
Hello, I'm actually Anna Rek, representing Lydia Makarov, who could not attend the entire call. I'm the Community and Communications Manager at the European Cancer Patient Coalition, based in Brussels, in Belgium. And we are an umbrella organization of more than 400 cancer patient organizations in 44 countries. How you can contact us, you can either send an email on info@ecpc.org or just simply go to our website www.ecpc.org and find all of the contacts to the entire team. And to give you an idea of our activities, we are, for instance, now partners of the very successful another IMI project, Prefer, and how we contribute and how we can contribute to the project is to provide horizontal support in order to ensure every patient-centered approach and lead the dissemination and communication activities linking patients in Europe.
Thank you. 30 seconds are up. Thank you very much. We will mute you again now, and next up is Andreas Weinhäuser. So I hope that my pronunciation of that is okay. Andreas, you are unmuted.
Can you hear me?
Yes, very well, thank you.
Okay. Yes, thank you very much. I'm Andreas Weinhäuser, coming from the Austrian Institute of Technology, and we are specialized in molecular diagnostics, especially biomarker and assay development. We have been dealing also with prostate cancer, especially with immunomics, using protein microarrays, and we can provide this kind of data and would be happy to fill up the gaps if data are missing, especially in the epigenomics and immunomics field. And if there is a proposal, we would be happy to join.
Thank you very much, Andreas. You were very efficient with the time as well. So next one is Prostate. Apologies again for the pronunciation. You are now unmuted.
Okay, I'm Prostate. I'm a professor of urology at Uppsala University, Sweden, and I'm chair of the National Prostate Cancer Registry in Sweden, which holds 150,000 men in a population-based registry, and we have an existing nationwide network for further collection of data. So that is my possibilities for contribution.
Thank you very much, Par. That was very clear and very brief. Next one up is Akari Caracedo, if I get this right again. You are now unmuted by us. I think that you are also muted from your own computer, Akari. So, yeah, you should now be unmuted and able to speak.
Thank you very much for this opportunity. My name is Akari Caracedo. I'm from Center for Life Science in CIC Biogune in Spain. My contact is easily reachable in the list of participants. It's acaracedo@cscbiogune.es. There is an available summary of our main line of research in the ESC website, but our interest is to put the boundaries between biology and discovery and stratification and therapy. So we try to make some meaning from discovery approaches to provide signatures for stratification and therapy. Our strength is providing meaning to HD data, and we are a functional group with academics, clinicians, oncologists, and neurologists, and we have in-house omics platforms, particularly strong in genomics and transcriptomics that can aid the discovery process. And,
your time is up. Sorry, I will let you finish again. Thank you very much. Next one is Eduardo Dominguez. Eduardo, you're now unmuted.
Thank you. This is Eduardo Dominguez. I'm representing our organization, Biopharma Research Group at Medicina Genomica from the University of Santiago de Compostela. We are located in Spain, in the northwest, and we can contribute. Our name list, our contact information is in the list of participants. We can contribute in 3 aspects to the consortium. We have a genomic sequencing platform that provides genotyping and molecular diagnosis for cancer patients, including breast cancer and colorectal, but also expanding our network organization to prostate as well. Actually, we are collaborating with Archives on that matters, and we also provide a chemical screening platform that can develop assays and screen molecules with the models that are identified through the biomarkers that are coming from genomic information. We also have...
Eduardo, sorry, we are up with your time again. I'm sorry about that. And next up is Carlo Cavalier. Carlo, I have now unmuted you, but you are self-muted. So if you could please make your microphone work, that would allow you to speak.
Can you hear me?
Yes, I can hear you, Carlo. Thank
Yes,
you.
okay. My name is Carlo Cavaliere. I am a radiologist and represent SDN from Naples, Italy, an institute specialized in vitro and in vivo diagnostics. We have a lot of MR scanner, 1.5 Tesla and 3 Tesla, and we have an hybrid PET-MR system, but also PET-CT, a radiopharmacy, and we have also a biobank where we collect biological samples and tissue from oncological patients. And we have an expertise in a radiogenomic approach, combining imaging and molecular markers to do a better diagnosis and to evaluate the prognostic markers. So you can contact me by email, and my email is ccavaliere@sdn-napoli.it. Okay.
Thank you very much, Carlo. And next one up is Rene Kishek. Just 1 second, Rene. You are now unmuted.
Okay, good afternoon. Can you hear me?
Yes, thank you.
Okay, perfect. My name is Professor Kizek. I'm from Czech Republic, from the Laboratory of Molecular Nanotechnology and Nanomedicine. You can contact me by email, kizekr@vfu.cz. We are focusing on the diagnostics of prostate cancer via its specific markers. The main field of our research is nanoparticles, which are used in miniaturized and easy-to-use devices. Thank you.
Thank you very much, Rene. Now the next one up is Katong Sales. Just a moment, I will have to unmute you, and it's now be working.
Can you hear me?
Yes.
Yes, I'm SME based in Frankfurt, Germany, with real-world data science skill, IMI2 reviewer experience at Brussels, and first-hand experience working with patients in clinical setting. We use a real-time stream analytic like Kafka based on concurrent use of multiple variables to create real-world data that is not only for personalized preventive prostate cancer diagnosis, but also trigger quantifiable positive behavioral change leading to patient trust, engagement, and relevant for pragmatic clinical trial. Most importantly, we try to find connection between 360-degree patient profile digital signature from real-world data using deep learning with genomic, omic, functional genomic research. Thank you.
Thank you very much, Kat, for this. Next one up is Tiziana Rancati from Italy. Tiziana, you are now unmuted.
Hello.
Hi.
I'm Lydia Makarov. I'm here representing the prostate cancer unit headed by Professor Valdagni at the National Cancer Institute in Milan, Italy. Our institute is a reference center for prostate cancer in Italy with more than 250 new patients per year. In addition to the clinical staff, the prostate cancer unit employs 20 people devoted to research activities. We have expertise in large international trials, including data management and analysis, and search of clinical, radiomic, and biological prognostic factors. You can contact me by email. I think my email is on the list of participants to this webinar. Thank you.
Thank you very much, Tiziana. Now I see that Madi Amina raised the hand, so I was wondering if perhaps this is also a request for a pitch. Madi, I've unmuted you in case you have a question or in case you would like to introduce yourself.
Yes, please. Practically, I'm Madi Amina from University of Central Lancashire, and I'm representing Intelligent System Group. Our group is very well experienced in analyzing statistical and machine learning methods for genome, and we have got some experience in genome analysis for animal traits. We also experience in machine learning and computer vision technique in analyzing images and deep learning method to help diagnosis of various sort of cancers. Thank you.
Thank you very much. We also have Anna Catarina Souza. Anna Catarina, you may now speak. Anna, can you hear us? I've unmuted you, so your microphone should now be working, and I see from here that it should work. Perhaps, Anna, we will wait a couple of seconds for you. If you could try and switch on and off your microphone just to make sure that it does work. In the meantime, I also know that Laszlo Bence was interested in introducing himself. Laszlo, just 1 second, because I couldn't see before your connection. I can't see if it's an internet connection or a phone connection. So if you could try perhaps and speak so that we can see if your audio works well, because I don't have any indication if it's working or not from here. I've unmuted you, so you should be able to speak. Can you hear me, Anna? Hi, Anna, can you hear us? I'm afraid this is not going to work, and I'm really sorry about that. From here, I see that you have a computer connection and you are unmuted, but for some reason, your audio is not working. Laszlo, so you say you are muted. I am trying again to see where you are. No, unfortunately, I cannot see your type of connection, so I cannot do anything to mute you or unmute you any further. So maybe if you could quickly switch to the alternative method of connection. If your audio, please dial in using telephone, or if your telephone, please try to go on to audio. And in the meantime, we may just get some final remarks by Paul. And if that works out, Laszlo, we will get your presentation just before the very end.
Thanks, Alessandra. I just wanted to add, one of the collaborators actually commented to me offline to mention that I didn't say we are interested in both prospective and retrospective data, just to make that point clear, that we have new prospectively collected data as well as this sort of existing big data is both considered for this project. And To add, I think the potential partner pitches that was new went extremely well and was very much a success. It was great to hear everybody's interest and where everyone's coming from on the potential applicant side. So well done, and thanks.
Thank you very much, Paul, for this. So I don't see any more questions, and unfortunately it seems that the audio problems we have with Laszlo and Anna cannot be sorted quickly, so I'm really sorry about that, but it seems to be a technical issue from the audio side. Andreas was asking if any slides could be shared from the people that gave a pitch. Our suggestion, Andreas, is that because we are going to circulate the participant list, so you're going to have the email addresses of everyone, is to try and make contacts with other participants separately instead of perhaps from our side circulating more slides. So you will receive the presentation, you will receive a link to the recording of this webinar, and then you will also receive a participant list. And we do encourage you to get in touch with all the other participants, and especially of the one you made notes today that have an interest in participating in an applicant consortium. So with this in mind, I think we can bring this webinar to a close. Thank you very much to Susanna, to Paul, and to all the other topic writers that participated in drafting the topic and preparing the material for this call to be launched. Thank you very much, Colin, for your assistance and for looking after this topic and the future project that will stem out of it. And thank you all of the participants, especially for the patience that you had today in waiting for the pitches. It's the first time we do it, and we think it's actually very successful. Perhaps we're going to try to fine-tune it for the future. But in any case, it was very good to hear from all of you and give you the possibility to network with other webinar participants. So thank you very much. Good luck for your application. And if you have any questions, do not hesitate to get in touch with us by using the email address info@imi.europa.eu or calling the program office here in Brussels. Thank you very much again, and goodbye.